welcome to the deep dive. Today we're looking at something, well, potentially quite dangerous that might be in your home. It's called baclofen. We're going deep into baclofen toxicosis, specifically in dogs and cats, using a medical overview as our source material.
Yeah, and this is really crucial stuff if you have pets. Understanding these household dangers, it's just fundamental to keeping them safe.
Exactly. So our mission today is to pull out the most important bits from this medical text, make it clear, understandable, and really highlight the key things you need to know, especially if, an emergency happens.
Right. Let's get into it.
Okay, so first off, what is baclofen exactly?
So baclofen, it's a drug for humans. It's a muscle relaxant, works centrally, so in the brain and spinal cord.
Okay.
People take it for conditions like multiple sclerosis, sometimes cerebral palsy, spinal problems, basically where muscle spasms are an issue.
And how does it actually work? The source mentions GABA receptors.
Yeah, GABA receptor. So GABA is basically like a brake pedal in the nervous system. It's an inhibitory neurotransmitter.
Oh. Okay. Baclofen hits these GABA receptors, and that stops the release of other signals, including some involved in pain transmission, like substance P. The end result is, muscle relaxation.
Gotcha. Now, the source says vets might use it extra label sometimes in dogs. What's that mean?
Extra label just means using a drug for something that isn't specifically on its approved label, like using it in a different species or for a different condition.
Right.
In dogs, it's been used occasionally, the source says, for certain urinary issues, specifically problems with urethral resistance.
Okay. And there's a specific dose.
Yeah, very specific, 1 to 2 milligrams per kilogram by mouth every 8 hours. And this is a big but.
Yeah.
The source really stresses it's rarely recommended.
Why so cautious?
Because the safety margin is incredibly narrow in dogs, like wafer thin. The difference between a therapeutic dose and a toxic one is tiny.
Wow.
And for cats, it's a definite no-go. The source is clear. Not recommended for cats at all. That's a strong warning. And the toxicity levels you mentioned, they sound quite low, like 1.3 milligrams per kilogram, causing problems in dogs.
Exactly. It doesn't take much. And worse, death has happened at doses of just 8 to 16 milligrams per kilogram.
That's really scary. A single pill could be lethal for a small dog then.
Potentially, yes. It really hammers home how potent this stuff is for our pets.
So who's most at risk here? Is it mainly dogs getting into it accidentally?
Well, the data mentioned shows more reported cases in dogs, yeah. But honestly, any pet is at risk if they can get access to it.
Right.
And we just said cats are extremely sensitive. So while maybe fewer reported cases, the danger is very high for them.
So if someone in the house actually takes baclofen for a medical reason, that obviously ups the risk.
Absolutely. Just having it in the house means there's a chance, a pill gets dropped or the bottle's left accessible. Storage becomes super critical.
Okay, so let's imagine the worst happens. A pet gets into some baclofen. How fast do problems start?
This is one of the most alarming parts. It's usually fast, like really fast, often within 15 minutes.
15 minutes?
Yeah. Sometimes it might be delayed a few hours, but typically it's very rapid onset. That's critical for owners to understand. The window is small.
Wow. Okay, so what are the actual signs? What would you see?
It can be a range of things. They might start vocalizing strangely, whining or crying. Vomiting is common.
Right.
Then you might see ataxia that's like being wobbly, uncoordinated, disorientation, like they don't know where they are, drooling a lot, lethargy, depression, just general weakness. And it can get much worse.
How so?
It can progress to coma, flaccid paralysis, where they just go limp, they can't stand or even lift their head. Seizures can happen too. Yeah. And hypothermia, their body temperature drops.
That's a terrifying list.
Yeah.
What about the absolute most life-threatening signs?
Breathing. That's the big one. Baclofen can cause difficulty breathing, that's dyspnea, and then respiratory depression, where their breathing slows right down. And eventually, it can lead to respiratory arrest. They stop breathing. This is often because the muscles needed for breathing, like the diaphragm, become paralyzed.
That's incredibly serious. So if a vet sees a pet like this, they suspect baclofen. But what else might be on their mind? What else looks like this?
That's a key point. It's called differential diagnosis. They have to rule out other things. The source lists a whole bunch of possibilities.
Like other toxins.
Yeah, exactly. Things like benzodiazepines, Valium-type drugs, other sedatives, alcohol, ethylene glycol, that's antifreeze.
Right.
Even illicit drugs like marijuana, LSD, PCP, hallucinogenic mushrooms, methanol, opioids, propylene glycol, tranquilizers, xylitol. Lots of things can cause similar neurological or depressive signs.
Wow, quite a list. And it's not just poisons, right?
Right.
Medical conditions, too.
Correct. Things that affect the nerves and muscles, like certain types of paralysis, botulism, tick paralysis, some infectious causes like Neospora or toxoplasma, and metabolic problems too, like a liver disease causing a hepatic encephalopathy, or even just low blood sugar, hypoglycemia.
So it's complex to diagnose then. Is there like a specific blood test for baclofen?
Not really, not on the standard panels. Routine blood work, urine tests, they're mostly helpful for ruling out those other things we just listed.
Oh, okay. So they check kidney function, liver enzymes, blood sugar, that kind of stuff.
Exactly, to see if something else explains the symptoms.
So if the standard tests don't pinpoint baclofen, what does help the vet figure it out, especially with the breathing issues?
Assessing their breathing is paramount. So things like arterial blood gas analysis that measures oxygen and CO2 levels directly in the blood, very informative. Pulse oximetry, the little clip they put on the tongue or ear that estimates oxygen saturation, useful, less invasive.
Right, I've seen those.
And end-tidal CO2 monitoring. That measures the carbon dioxide they breathe out, which tells you how well they're actually ventilating moving air. High CO2 means they're not breathing effectively.
Got it. And what about x-rays? Are they part of this?
Chest x-rays, yeah. They're important mainly to check for aspiration pneumonia.
Aspiration pneumonia, that's from inhaling vomit, right?
Exactly. If the pet vomits, especially while they're sedated or weak from the baclofen, they can inhale some stomach contents into the lungs, causing a nasty pneumonia. It's a serious complication.
Okay, this all sounds incredibly urgent. What's the absolute first step if you even suspect your pet got into baclofen?
Call your vet immediately, or an emergency clinic if it's after hours. The source really emphasizes that many of these cases get serious fast, so considering referral to a 24-hour critical care center is often a good idea right from the start. Time is absolutely critical.
So getting professional help ASAP. Then what happens at the clinic? What's the initial treatment?
It starts with decontamination, if possible, and supportive care.
Decontamination.
Yeah.
Like making them vomit.
Potentially, yeah. If the ingestion was super recent, like less than an hour ago, and the pet isn't already vomiting or showing significant neurological signs, the vet might induce emesis, make them throw up.
Okay.
If it was a really large amount, they might consider gastric lavage, basically, flushing the stomach. And then usually a single dose of activated charcoal. That stuff helps bind up any toxin left in the gut to stop it from being absorbed.
And the supportive care part, what does that involve?
That's really the cornerstone. It means intensive care, basically. Intravenous fluids, IV fluids, are crucial, often given at a higher rate, like 1.5 to 2.5 times the normal maintenance rate.
Why so much fluid?
It helps maintain blood pressure, supports organ perfusion, getting blood flow to the kidneys, liver, brain, and it can help flush the drug out of the system faster.
Makes sense. And monitoring continues.
Oh, absolutely. Continuous monitoring, watching their heart rhythm for arrhythmias, checking their breathing rate and effort constantly, listening to their lungs for signs of that aspiration pneumonia.
And if they are having trouble breathing?
Oxygen therapy is a must. A mask, an oxygen cage, whatever's needed.
Okay.
And in the really severe cases, if they're hypoventilating, not breathing enough, or they stop breathing, they'll need mechanical ventilation. A ventilator breathes for them.
Wow, okay. Intensive care indeed.
Yeah. And managing their body temperature too, warming them if they're cold, sometimes cooling if they overheat from seizures, for example.
The source mentioned some advanced things too, like hemodialysis.
Yes, for very severe refractory cases. Hemodialysis and hemoperfusion, these are techniques to filter the blood directly, removing the baclofen. They can significantly shorten the duration of toxicity.
Okay, let's shift to specific medications used during treatment. The source mentioned atropine.
Right. Atropine is used if the heart rate gets dangerously slow. That's bradycardia. It helps speed the heart back up. The source gives specific doses for dogs and cats.
And for the vomiting, are there meds for that?
Definitely. They'll often use anti-nausea meds, antiemetics. Meropitant is a common one. The source lists the dose, usually given once a day to stop the vomiting.
And what about seizures? That sounds terrifying.
It is. Diazepam, which is Valium, is usually the first go-to drug for seizures, given intravenously.
Okay.
The source notes using the lowest effective dose because remember, baclofen itself is sedating, so you don't want to overdo it.
Right. What if diazepam doesn't work?
Then they might move to other things, like propofol, which is an injectable anesthetic given as a constant infusion, or even general anesthesia in really difficult cases to control the seizures.
And some pets get agitated or disoriented, right? Is there anything for that?
Yeah, that can happen. For agitation, they might use asapromazine, but carefully the source warns it can cause low blood pressure, which might already be an issue.
Mm-hmm.
So low doses, or they might use diazepam again or midazolam, which is similar.
Okay. And cyproheptadine was mentioned too, for vocalizing and disorientation.
Yes, cyproheptadine. It's an antihistamine but has some serotonin effects, and it can sometimes help with those specific signs. Again, the source gives doses for dogs and cats and different ways to give it, like by mouth or even rectally.
There's also something called intravenous lipid emulsion, ILE. Sounds different.
Yeah, ILE. It's a, relatively newer approach, but quite established now for certain toxicities, especially fat-soluble drugs like baclofen.
Fat soluble. Okay. How does it work?
The idea is you infuse this sterile fat emulsion, basically like IV nutrition, but used differently here. The fat droplets are thought to create a sort of lipid sink in the bloodstream.
A lipid sink.
Yeah, they essentially trap the fat-loving baclofen molecules, pulling them out of the tissues and blood plasma, making them less available to cause harm. It might also help provide energy to cells affected by the toxin.
Interesting. So how is it given?
The source outlines a specific protocol, usually an initial bolus, like a big quick dose, followed by a continuous infusion, a CRI, over maybe 30 to 60 minutes.
Okay.
And they might repeat the bolus or continue the infusion depending on how the pet responds. But if there's no improvement after a certain point, they'd stop it. It's often used in really critical, life-threatening situations.
Are there drugs you absolutely should avoid giving?
Well, besides being cautious with the spromazine because of blood pressure, the general rule is to be very careful with any sedative, since baclofen is already causing sedation. And definitely avoid drugs known to depress breathing further, like phenobarbital is mentioned as one to avoid.
Okay. So with all this going on, the monitoring must be intense.
Oh, constant. Absolutely
Yeah.
constant. Vital signs, heart rate, breathing, temperature, obviously. Blood pressure monitoring is crucial.
Mm-hmm.
And then the respiratory monitoring, we talked about blood gases, pulse oximetry, end-tidal CO2, keeping a super close eye on their oxygenation and ventilation.
And beyond the machines and meds, what about just basic care?
Hugely important. Good nursing care is vital. Things like turning the patient every few hours if they can't move themselves to prevent pressure sores,
Yeah.
keeping their eyes lubricated if they're comatose or sedated, keeping them clean and dry, maybe passive range of motion exercises for their limbs, soft bedding. All that supportive stuff makes a big difference.
We've covered a lot about treatment, which is critical, but prevention is always better.
Yeah.
What's the main takeaway there?
It's simple, really, but so important. Keep
Yes.
medications away from pets. Educating owners about the risk that these human meds, even just one pill, can be deadly is key. Secure storage, child-proof caps, keeping things off counters and bedside tables. Basic vigilance.
Absolutely. So let's talk outcomes. What are the main complications to worry about during recovery?
Aspiration pneumonia is probably the biggest one, given the mix of vomiting, sedation, potential seizures, and muscle weakness. It's a serious risk.
Okay. And how long does recovery usually take if things go relatively well?
For serious intoxications, the source suggests recovery often takes about 5 to 7 days.
A week. Like so.
Yeah, it can be a long haul. But the good news is, if they get through it with prompt, aggressive care, they often recover fully with no lasting effects.
That's encouraging. But the prognosis isn't always good.
It really depends on the dose, how quickly treatment was started, and whether complications develop. The prognosis is generally good with early, appropriate care, but it becomes poor if treatment is delayed. And the source specifically says the prognosis is more guarded, meaning less certain or potentially worse, if the pet has seizures or develops aspiration pneumonia.
Okay, so wrapping this up, the key things to remember. Baclofen, very toxic, especially cats. Tiny amounts can cause big problems fast.
Super fast onset, yeah.
Signs are serious vomiting, wobbliness, coma, seizures, and critically breathing problems.
Right. Respiratory arrest is the killer.
And because of that speed and severity, immediate vet care, ideally at an ER or critical care facility, is absolutely essential for a chance at a good outcome.
Couldn't stress that enough. Early, aggressive treatment is everything.
Knowing this risk helps you, the listener, take those preventative steps. Secure your meds. It sounds simple, but it saves lives.
It really does. The speed and danger here just highlight why we need to be so careful.
Definitely. This whole deep dive, it really makes you think, doesn't it, about how many common household things, especially prescriptions, can be potential hidden dangers for our pets.
Mm-hmm. It's not just baclofen, unfortunately. Lots of things to be aware of.
Yeah. Something to definitely keep in mind and maybe look into further. Thanks for joining me for this really important discussion today.